everyone, welcome to week 5 of our class. On the downhill slide now. Just remember these classes, if you're new to classes in the HSA program, they are 8 weeks long, the 7th week being the last full week. Week 8 runs Monday through Friday, so just be aware of that. All assignments will be due for week 8 on Friday of that week. So this past week we talked about information technology and healthcare. Took a look through, graded most everyone's infographics already. Really nice job on them. The key is that we can have a whole, an article full of text about something, but it may not pique the reader's interest. But with having some pictorial representations of various things that you're talking about in the narrative, it can really, catch someone's eye and make them more interested in the topic. So hopefully you found that to be fun. I like to build those myself. I think they're interesting and can be a nicer assignment than yet just another paper. So hopefully you enjoyed going through that. And if you got an email from me, there was some that I was unable to see. So if you got you would have received an email from me this morning. Just get that information back over to me however I described it to you. Different situations call for different measures, but just get that back over to me and I'll get your infographic graded as well. So this coming week, week 5, we are going to talk about human resources. And human resources is obviously, you can get an entire bachelor's degree, master's degree, etc. in human resources. But it's, we talk about it in the healthcare world because the staff that we're recruiting and trying to maintain in the healthcare world are a little different than if you worked for, just a big corporation or in retail or hospitality. It's a little different in healthcare because we have to have not only staff that are a good fit and fit within the organization, the culture, etc., but they also have to be skilled in certain areas. So we need to make sure we're checking on the backgrounds of employees perhaps a little more closely than we do in another situation like at a store or in a big corporation, whatnot. I mean, obviously, most organizations do background checks, but now you have to be checking with the Office of Inspector General. You have to be checking with licensing agencies or certification agencies, etc. So it can be a little more complex. But what's interesting is that a lot of our students in this program tend to like HR and tend to move into that field. We've had several students graduate and end up working in human resources. So it's certainly something that interests many people, and hopefully we'll talk about it for 1 week here, but as you move into your concepts classes, and if you are an HSA major, into your there's an entire class specific to human resources. Hopefully as you move into those, you'll find them to be interesting as well. So we have some reading. Obviously, we have our discussion this week in Flipgrid talking about employee retention. This question was developed long before COVID, but with COVID, it's the whole notion of employee retention and avoiding burnout is a significant issue. So good items for discussion this week. We do have another group assignment this week. Groups are different. I've done my best to update them based on, we had a couple of folks at the beginning drop the class, so I've updated the week 5 groups, but as I think I'd mentioned last time, it's important for everyone to work as a group. I really encourage you, today's Monday, first day of the week, I really encourage you to start to get together now and get, kind of get the ball rolling. Some students like to work during the week on their assignments. Some students, are kind of have to push the work to the weekend because of work or family or whatever. It's best to talk about all of that up front. So maybe one student will have a task that is more during the week, and then another student can have a task that's more, last minute, getting things together to be submitted. But also remember, I think I said this in the probably the week 3 discussion. But it is a group assignment, so don't just divide. There's 6 questions on here. Don't just divvy the work up between people and then don't ever look at anybody else's answers. You need to be submitting a group assignment. So if what the person answered to question 1 and someone answered to question 2, and if they conflict, it'll be pretty obvious to me that you didn't work as a group. You simply all just divided the work and then submitted it. So please work as a group. Like I said before, the purpose of these group assignments is not to cause you all pain and suffering. I myself know, the pain and suffering of working in a group, especially in the online setting. But please take the time to work with your group and be able to submit the assignment. We do have, again, a self and peer assessment, as I will always have on my assignments, and Dr. Hampy and Dr. Frindak will have something similar, if not exactly the same thing, for theirs as well. So just be sure to manage that. If you have students that are non-responsive in your groups, then sadly, that's just part of a group, and those, make sure that it's detailed on that assessment, and grading will take place as detailed in the assessments. And also know that sometimes they'll have a student that will be concerned. Maybe they did disagree with one of their colleagues and they're afraid they're going to get bashed on their assessment or whatever. Please know that I don't take just a single form I will take into consideration all of the forms I receive for your group, and if there's a common thread or a common theme, then that is when grading starts to change. But if I see really different answers amongst students, that's when you'll get an email from me to chat about it a little further, either via email or phone or however works best for you. So, but just please remember to submit that. If you do have any problems along the way, please don't hesitate to get in touch with me. And obviously we have our quiz and our Ed Puzzle, which is this. So let's take a look at our quiz from last week. So obviously we're in week 5. Last week was our information technology week. So just a few questions in that range. So software applications in healthcare have traditionally been used to manage. And so our correct answer here was healthcare expenses. Generally, when you see that word traditionally, that means going back in time, as opposed to changes that we're seeing in modern time. So traditionally, software, and we've always used software to manage the financial side of the healthcare operation, going all the way back to when I started in healthcare, gosh, now almost 30 years ago. So we've always used software, computers, to manage that. And just think about your own budget that you might manage. Okay, I get paid this much, I have these bills, I want to go to this concert, I want to go to this show or this ball game or whatever, and you're managing that for yourself. Now think about managing that for a massive hospital or a large healthcare, single healthcare entity like UPMC or something of that nature. Computers are required to manage that kind of data, just because it can be used to help to process, make sure things are accurate, catch things that perhaps would be missed by just an accountant using a spreadsheet, a general ledger form or something like that. We did used to do those things by hand, but not in my lifetime in the healthcare world. But certainly ledger books and those types of things were kept years ago. What wasn't used traditionally were software applications to assist in the clinical operations. So physicians, clinical staff, clinical operations, nurses, they didn't traditionally use software. Hospitals started to come around to electronic systems, electronic health records, etc., probably in the I'm going to say late 90s, mid to late 90s, and then not until 2010 did we really see a massive push to get every hospital, every physician practice on an electronic health record system. And now we're seeing the next evolution of that. So most everybody has, it's been 10 years, 11 years since HITECH Act was passed, which gave organizations money to buy an EHR. Now we're starting to see the next evolution, and we talked about that a bit this week as well, which is the notion of big data, evidence-based decision-making, use of clinical decision support systems to help physicians and other clinical staff to manage the symptoms and manage treatment of patients. That is not going as well with implementation, at least on the physician side. Many physicians find them to, kind of have an oversight of their work, and physicians obviously go to school for a very long time. They intern and they serve as residents, and then they take board exams and licensing exams, and there are many physicians out there that take the view that they're not going to take advice from a computer, that they know what they're doing. I see that younger physicians coming into the field are more accepting of technology, so I think eventually we'll see. We saw it with the electronic health record. When we really started to push that into hospitals, physicians rejected it. And now most are, they realize they have to live with it. I think we'll see the same thing with clinical decision support systems because they are helpful. They can catch things that perhaps the physician misses, maybe because they just haven't had time to stay on top of the latest and greatest in research. So our answer here is healthcare expenses, mainly because the clinical realm was not as interested in using software to help with their work. Computer systems were not used initially by clinicians because early systems, I know that I tend to get a lot of complaints about these questions, but the key with doing multiple choice questions is that you find the best answer, not just the correct answer, because sometimes you'll see that there is more than one answer that is technically correct, but you want to find the one that is best suiting the situation that you have here. So the answer is took more time to use and were cumbersome to use. It wasn't necessarily because they were expensive, because oftentimes these were systems in hospitals. The clinicians weren't paying for them, so they didn't care if they were expensive or not, but they did care that it took more time and they were kind of a pain. So those are the two answers that were correct. So you can see our answer D is the best answer because it takes into account both of those things. Next question, which are potential benefits in having clinical data automated and able to be exchanged with other care settings? Again, similar type question here. You're looking for the best answer. So our best answer is reduction in the number of repeat tests, ability to more quickly identify relevant information about the patient. So it's both the reduction in the number of repeat tests. For example, if I went to my primary care doctor, had a test done, then went to my specialist, instead of my specialist ordering another one for me, they can just look at the results from my primary care doc because it's a shared record. Ability to more quickly identify relevant info. Same type of thing. If I end up in an emergency department while I'm away on vacation, maybe they can, open up the medical record, somehow have some health exchange going on, and they can see, oh, well, she's allergic to amoxicillin. Let's make sure we don't give her that. Or she has a sensitivity to this or that. So it's important to be able to share that information. Sadly, we don't really do that very well yet on a nationwide situation, but we do see sharing obviously within health systems, and then also within geographic areas. Sometimes you'll see some sharing of information. But so our correct answer here was E. Last one, reports by what organization brought to the American public the issues and/or opportunities in safer care through the use of computers? So our answer was D, the IOM, Institute of Medicine, and the textbook talks about a couple of different publications that they came out with, but the one that I think was really the crux of why we made this big switch into use of computing and technology for healthcare was To Err is Human. So that To Err is Human was a report that was put out by the Institute of Medicine showing the massive rates of patient safety issues and errors with regard to healthcare in our industry, in the healthcare industry. And by using computing resources, technology, we can help to avoid those things. We can make healthcare safer. when that report came out, one of the things they said is probably the most dangerous place you could be is a hospital. And so we've made strides to correct those things, correct those errors, and provide a healthier situation, safer situation for patients that are coming into the hospital. So our answer was D, Institute of Medicine. So that's all I have for this week. If you have any questions, let me know. Like I said, if you got a note from me about your infographic, just follow up on that and I'll get your infographic graded. And that's all I've got. So talk to you all in class this week. Thanks.